Hello, welcome all. I am back with another opportunity. That's early career investigator opening at Harvard University Center for AIDS Research, and they have asked directly for request for proposal. And the proposal which has been asked now, this is one of the specific opportunity in the field of HIV and AIDS, and the cohort is open for the February of 2024. But we have to keeping in the mind that the February 2024 is not having a long time. So previous to it that we have to complete all the forms and we have to go through a lot of process. And after that, we will be going to be at the last moment that whether it will be going to be selected or not. So one of the major thing which I want to discuss with you all that once I have completed my Master of Public Health at that time in the year of 2017, I was not aware about that there is a lot of international opportunity at that time. In fact, that was available at that time as well. But in the last year, one of my friend has been got selected the fully funded PhD in one of the country. So since that time, I started focusing on some of the international opportunities. If anyone is going to get this opportunity, then why us cannot? So we have to work on that, and we have to look for that, and that the perspective is over there. That we have to do something else to get it work as a ladder for our career opportunity to achieve a peak in our careers. So, likewise, discussing on the AIDS research. So, we are this area is getting stagnant, and so we have to work on this as it is a global public health crisis at the current situation. And a rough data is showing that 75 million people are infected with HIV. Apart from this 75 million, 32 million died of AIDS related illness. And in fact, their antiretroviral therapy has changed the perspective from deaths to something like this manageable chronic illness. So that the in fact one of the achievement, but a lot of area is over there we have to proliferate and we have to work on that. In fact, one of the major challenge with our scientists, even not only with the scientists, we can say that global scientists, that vaccine development. Apart from a lot of research and ground reality, we are working at the ground root level as well. A lot of HIV program is going on. Still, the social stigma is over there. So, being a public health professional, we have to work on removal of and reduction of stigma. Apart from this, likewise, 75 million and 32 million of deaths. So that is also increasing a burden of expenses. So getting reduce these numbers so we can improve our economics as well. So let's start without delay. So what this fellowship and awards option gives. So there is a two availability of award in this. So we will discuss about the both. The duration is given for this one is providing 1 year of 1 year of award, and another is providing a 2 year of award. And one more thing is one stop is over here that one person can fill any one of this application only. So let's start with the likewise the deadline has been given for this form is November 1st 2023. So purpose is over there. RFP has been asked for the two of opportunity, that is K awardee and T32 awardee. So we will be more focusing on T32 awardees because it is directly getting in our touch since after qualification of master's degree. The proposal must has to be aligned with NIH guideline and the high as well as medium priority which research focused area which is directly related to the HIV one. We will discuss that as well. So as we are from India, so we will be considered as international applicants. So one extra part will be over there that we have to take we have to take two guides. So the research priority which is coming is specific to the research towards HIV cure, and the five cohorts they have taken. The first, likewise, key research toward HIV cure, in which vaccine development will come, and PEP will come, post exposure prophylaxis will also come, HIV testing will also come in over here, treatment adherence and treatment increment will also come in this area, and monoclonal antibodies. So post exposure prophylaxis we can look for proposal in this area. The second is reduce the incidence of HIV cure. So over here, only one cohort, as per my knowledge or as per my research, so that we can do or we can submit for the proposal for viral eradication. While the cross-cutting area is the major chunk where all the public health professional can come and they can apply over here. And I will also recommend you all to submit your proposal in this area only, because it's our direct intervention is coming over here. So behavioral and social science directly touching is over here, we can submit proposal in this. The second one is that key epidemiology, some of the HIV is relation to it, any of the proposal we can submit over here. And the major thing is research innovation and capacity building, any of the plan we can submit over here. So develop next generation HIV therapy. So in this only one we can go third retention of care, how we can do that. Apart from this, address HIV associated comorbidities and co-infections. So in this key, cardiovascular complication has been seen in the patient along with HIV. Apart from this, some of the neurological problem is coming as a comorbidity over here. So some of the plan we can submit and proposal accept related to this. Apart from this, we can touch one of the major area that is mental illness as well, and substance abuses we can also submit it over here. Apart from this, some of the metabolic disorder is also, if any one of us is having a proposal, we have to submit. So that will address in HIV associated comorbidity, co-infection and complications. So the dates, important thing is that the date is coming over here. So we have to think for it that if we are having any of the queries the above four dates which is showing that September 29 and 2023 is the last options. So if any of us before submitting our proposal and we are having any of the issue under coming bio studies and bioinformatics, so we can submit it over here. Likewise, it will the core committee consultation committee is over here, and I will provide some of the information details with you to whom you have to contact. And these biostats and bioinformatics core consultation will give you the support and guidance on grant preparation as well as your study design, statistical analysis as well bioinformatics. Some of the part is over. So regarding clinical core consultation and these two we will discuss later on. So we have to too cautious that we have to submit the forms previous to the 1st of the November, and we have to also take care about that the submitting process is very exhaustive, very long process. We will discuss that as well, and but that is not possible to cover that all the part in a single video. So we can discuss that as well in the later part. But the right now is that if like anyone is expecting, I think I will say that everyone should have to submit. So we have to start the process by today only, so that it will be going to complete within the timeline. And the final notification will come for the selection or disqualification that January to early of the February it will come. Likewise, the second part is coming clinical core consultation. So, if our proposal involving this patient recruitment, as we have discussed that HIV testing and treatment, we are going to work on that. So, if patient involvement is over there, so we have to consult that clinical core consultation, like the details has been given of the director and associate director as well in the slide only. So we have to go through that. If any consultation is required, they will support, they will provide all the helpful resources and the guidance how we have to go through that and how we have to submit it. And other department will help us that in the research methodology and statistical analysis and bioinformatics analysis. So that all will be assistance will be provided. While on the other hand, biobehavioral and community science core consultation. So as we have discussed this, these five major cutting area. So biobehavioral and community science core consultation will leverage clinical and biomedical cohort for social behavioral project like Weski socio-economics. If you are going to do behavioral and social analysis, social sciences, as well as epidemiological research, so they will guide us ki, how to shaping the application and the final touch on the application, pre-reviewing on the application, as well as linkaging to the existing cohort as well, how we can go through that. So the contact information has been also given. We have to go through that process. In the same way, program in health economics and modeling consultation is also over here. So that simulation models work over there too. Cost effectiveness analysis is over there. So economics, something interlinking HIV research with economics. So that will come over here. So that will directly impact on that key cost effectiveness only. So these cohort will also guide us ki about suitability of methodology, data collection adequacy, questionnaire development, how we are going to collect the data, what will be the suitable methods, and potential collaborator as well as experts. So I think that's okay. These are the major chunks where we have to think about that whether it is going to be select or it is going to be reject, no worries about that. But still we need to take the first step to move on. So we have to take our first step to think about that ki, we can work internationally as well. The mind and concept which we are having, we have to put the light on that, and we have to achieve and we have to reach at any specific platform where there's all the skills can be proliferated and presented. While the thing is ki mentorship, for this ki each applicant is required at least one mentor. But as we are coming under the international proposal submission, so additional mentorship mentors has to be required in this. Primary mentor and co-mentor. International applicant has to be go through the selection of these mentors and co-mentors. One is specifically required from the having Harvard affiliation. So, who will mentor from the Harvard guidelines and etiquettes to go through that guideline and implement that all in a single research. How we will be going to implement that, and the co-mentor will be specific to your countries or anyone who will be. While the supporting documents, both mentors and co-mentors has to be provide that letter of support as the letter of support format has been given. So we have to submit that letter of support as it has been asked. So if we are submitting a proposal involving some of the reaching of international site, so additional cost will be provided for that to achieve and implement that as well. Regarding any of the information for the mentorship, if you are facing any of the issue getting mentor from the site of Harvard, so you have to reach Andrea. While award funding direct cost which is provided to us, that we are looking for the 2 year of the mentorship. So in 1 year it will be providing that 75,000 US dollar in 1 year for the 1 year. Apart from this, 36% of fringe can be added over here, so it will be leaving to 102,000 US dollar. Apart from this, maximum direct cost will be 150,000. Uh, as we have discussed earlier as well, for international site, 16% of direct cost for each international site will be covered in it. So these all are the step and the guides which we have to think, we have to implement, and we have to proliferate to achieve the maximum in we can put our inputs in it. Apart from this submission process that we have to submit it uh, by the November 1st of 2023. The guideline and their policy is too strict. After this, they will be not going to accept. And the submission process includes that first one is the phase page, second one is continued for the phase page, and the third phase is summary, relevance, project performance sites where you are going to implement that. The four is also same. The five is a research grant table is directly, and the six is a research budget, initial budget period. It will be very critical to give all the budgets and this in the very small span of the duration. So we have to aware, we have to active, so that all the fringes will be calculated and added over here, so we can get that all this stipend over there. Resource format page, checklist is over there. Continuation format page is over there. Human subjects and clinical trial information, mailing address, and all personal report format page. So these 13 forms we have to fill, and I think that's okay. If we can take on the priority basis, so we can do it. Uh, Likewise, being an Indian, so what we can do, everything is possible for us, we can do it. So I will prefer that I will put implication over here that everyone who is qualified as master of public health and coming from this background and having some of the interest is in these five cohorts and in these five dedicated branches, so we should submit our application in this. So that's it from my side. Thank you for this. And for the next video, we will reach out with having some of the exciting opportunity. Till time, take care. Bye. Thank